The following is a demonstration of the TCC EZ Total Contact Cast System application process. The TCC EZ cast socks come in two sizes, a 3-inch diameter cast and a 4-inch diameter cast. If you are unsure of which size to use, ankle and calf measurements can assist with making a decision. The goal is to optimize the fit to lock the foot and leg in the cast to control motion. However, some foot deformities may not be accommodated in the TCC EZ. All of the components required for this total contact cast are included in the TCC EZ system. The primary dressing and patient information sheet are also included. Be sure to review the patient instructions and give them to the patient. Step 1. MedE-Foam Dressing. Do not use the dressing if the sterile packaging appears compromised. Begin by applying the foam dressing to the wound. Use the paper tape to secure the foam to the foot. Step 2. Tan Stockinette. Next, gather the tan stockinette and slide it over the foot and leg up to the patella and smooth out any wrinkles. Fold the distal end of the stockinette over the dorsum of the foot. Secure the end using plastic tape and cut the excess. Step 3. Protective felt pad. At this point, the patient is asked to hold their foot perpendicular to the leg. Apply the protective felt pad with the shorter, narrower portion to the tibial crest, over the dorsum of the foot, and along the bottom of the foot past the heel, ending at the Achilles tendon. Ensure that the malleolar discs cover the bony ankle prominence and anchor the pad with the plastic tape. Do not tape around the circumference of the leg. Leave a finger's width between the toes and the padding so as not to impinge the toes. Trim the corners at the heel for contouring and cut the padding at the heel, allowing for 1 to 3 inches of excess padding. The patient's leg must be at 90 degrees or the padding will wrinkle. Step 4. Thick white sleeve. Apply the thick white sleeve over the protective felt padding. Start by rolling it into the shape of a donut. Place the sleeve over the foot and use your thumbs to unroll the sleeve, stopping just short of the tan stockinette at the knee. Ensure all protective layers are not being disrupted and are not binding the toes. Pull the sleeve to cover the toes and fold the excess sleeve over the dorsum of the foot. Secure with plastic tape and trim the excess. Step 5. Proximal cast edge. Cut the excess felt padding at the knee, even with the thick white sleeve, and fold the proximal end of the tan stockinette back to complete a finished edge. Step 6. Patient positioning. Place the patient on their stomach in the prone position. Although it is not optimal, the TCC EZ cast can be applied in a seated position if the patient cannot roll over. To protect the patient's clothing, you may drape the patient. Flex the knee and ankle to 90 degrees and position the foot in a neutral alignment. Step 7. Cast sock. Remove the cast sock from the bag. Roll the cast sock into a donut shape, leaving about 2 to 3 inches of unrolled sock. To ensure thorough saturation, immerse the rolled sock in room temperature tap water for about 5 seconds and gently shake out any excess water. Use one gentle stretch and apply the cast sock by positioning it on the foot so the unrolled end extends beyond the toes by about 1 to 2 inches. The placement of the colored stripes is not important. Gently unroll the sock towards the knee, using your thumbs to push and stop at the widest point of the calf. If necessary, slide your fingers between the patient's dorsal arch and the sock to smooth out any wrinkles. It is very important to remove all wrinkles as they can cause irritations. Fold back the excess cast sock over the dorsum of the patient's foot and hold in place. To complete a finished edge, roll the proximal edge of the stockinette distally, covering all loose edges. Then, fold back any excess cast sock to the widest point of the calf to shorten the cast length. Using wet gloves, contour the cast to the leg, ankle area, arch, and Achilles tendon. Continue maintaining the foot and ankle as close to 90 degrees as possible until the cast is firm enough to not change shape. Step 8. Dry time. The patient can now be returned to a seated position with the cast suspended over the edge of the chair. Allow the cast to dry for approximately 15 minutes or until the toe area of the cast is cool and hardened. With the design of the TCC EZ cast, it is normal and expected to have flex in the cast after it is fully cured. Step 9. Outer boot. Once dry, apply the outer boot by placing the hardened cast between the upright struts of the walker boot. Ensure the struts are aligned with or are parallel to the patient's tibia and fibula and place the heel of the foot at the rear of the boot. Secure the toe strap, the ankle strap, and the top strap. Adjust the top strap so it is snug around the leg of the patient to keep the walker boot positioned properly relative to the patient's leg during ambulation. Ensure the loose end of the top strap is still secured by the plastic strap holder in the back. To shorten the top strap, cut it just longer than the desired length to allow a small amount of fray and not leave a sharp edge. Allow the patient to weight bear. Instruct the patient that the outer boot must be worn for ambulation. Ambulation without the boot will cause instability, could damage the cast, and delay progress. The first cast change will take place 2 to 3 days after the first cast is applied to prevent pistoning and maintain total contact as swelling in the leg decreases. Subsequent cast changes will take place weekly thereafter. Patients should wear a cast for 1 to 2 additional weeks post-healing to ensure the skin returns to full thickness.